1. A nurse is caring for a postpartum client who is experiencing heavy lochia and a boggy uterus. What is the nurse's priority intervention? Answer. The nurse should first perform fundal massage to stimulate uterine contractions and reduce bleeding. Rationale. A boggy uterus indicates uterine atony, which is a leading cause of postpartum hemorrhage. Fundal massage helps the uterus contract, minimizing blood loss and preventing complications. 2. A pregnant client at 32 weeks gestation presents with painless, bright red vaginal bleeding. What condition should the nurse suspect? Answer. Placenta previa. Rationale. Placenta previa occurs when the placenta covers the cervical opening, leading to painless bleeding. Immediate medical evaluation is required to prevent complications. 3. A nurse is educating a client undergoing a vasectomy. What should the nurse include about postoperative care? Answer. The client should use alternative contraception until 2 consecutive sperm analyses confirm sterility. Rationale. Sperm can remain in the vas deferens for weeks after a vasectomy. Contraception is needed until sterility is confirmed. 4. A laboring client's fetal heart rate shows late decelerations. What is the nurse's initial intervention? Answer. The nurse should reposition the client to the left side. Rationale. Late decelerations indicate uteroplacental insufficiency. Repositioning improves blood flow and oxygenation to the fetus. 5. A nurse is caring for a client with preeclampsia. Which finding indicates worsening condition? Answer. A decrease in urine output and severe headache. Rationale. Oliguria and headaches indicate worsening preeclampsia, possibly progressing to eclampsia or organ damage. 6. A client is undergoing an amniocentesis for genetic testing. What complication should the nurse monitor for post-procedure? Answer. Leakage of amniotic fluid and signs of infection. Rationale. Amniocentesis poses risks such as rupture of membranes, infection, and fetal injury. Monitoring prevents complications. 7. A nurse is delegating tasks to an unlicensed assistive personnel, UAP, for a postpartum client. Which task is appropriate for delegation? Answer. Assisting the client with ambulation to the bathroom. Rationale. Ambulation assistance falls within the UAP scope, while assessments and medical interventions remain the nurse's responsibility. 8. A client receiving oxytocin for labor induction develops contractions lasting over 90 seconds. What is the nurse's next action? Answer. The nurse should discontinue the oxytocin infusion. Rationale. Prolonged contractions, uterine tachysystole, can cause fetal distress and uterine rupture. Stopping oxytocin reduces this risk. 9. A nurse is assessing a newborn immediately after birth. What is the priority assessment? Answer. Airway patency and respiratory effort. Rationale. Maintaining airway patency and effective breathing is essential for newborn survival. Oxygenation takes priority over all other assessments. 10. A client with an ectopic pregnancy presents with sudden severe abdominal pain and shoulder pain. What is the nurse's priority action? Answer. The nurse should assess vital signs and prepare for emergency surgery. Rationale. Sudden severe pain indicates rupture, leading to hemorrhage. Immediate surgical intervention is needed to prevent shock. 11. A postpartum client is experiencing engorged breasts. What is the best nursing intervention? Answer. Encourage frequent breastfeeding or pumping. Rationale. Engorgement occurs due to milk stasis. Regular feeding or pumping relieves discomfort and prevents complications like mastitis. 12. A nurse is caring for a client with hyperemesis gravidarum. What lab value should be closely monitored? Answer. Ketones in the urine. Rationale. The presence of ketones indicates severe dehydration and metabolic imbalances, requiring fluid and electrolyte replacement. 13. A client in labor at 39 weeks gestation complains of severe lower back pain with each contraction. What non-pharmacological intervention can the nurse suggest? Answer. Apply firm counterpressure to the lower back. Rationale. Back labor is often due to occiput posterior positioning. Counterpressure relieves discomfort and facilitates fetal descent. 14. A client is diagnosed with pelvic inflammatory disease, PID. What is the most important education the nurse should provide? Answer: complete the full course of prescribed antibiotics. Rationale: PID is caused by bacterial infections such as chlamydia or gonorrhea. Completing antibiotics prevents complications like infertility. 15. A postpartum client is diagnosed with endometritis. What symptoms should the nurse prioritize? Answer: foul-smelling lochia with fever. Rationale: endometritis is a uterine infection often presenting with malodorous lochia and fever, requiring antibiotic therapy. 16. A nurse is caring for a client who just experienced a spontaneous abortion at 10 weeks gestation. What is the priority nursing intervention? Answer: provide emotional support and assess for signs of hemorrhage. Rationale: clients may experience grief, requiring emotional support. Monitoring for excessive bleeding ensures early detection of complications. 17. A client at 36 weeks gestation is admitted with preterm labor. What medication should the nurse anticipate administering? Answer: betamethasone. Rationale: betamethasone is a corticosteroid that enhances fetal lung maturity, reducing neonatal respiratory distress if preterm birth occurs. 18. A nurse is reviewing the prenatal lab results of a client who is Rh negative. What intervention is necessary at 28 weeks gestation? Answer: administer Rho-D, immune globulin. Rationale: Rhogum prevents the formation of Rh antibodies, protecting future pregnancies from hemolytic disease of the newborn. 19. A client undergoing infertility treatment asks about risk factors for infertility. What is an important factor the nurse should discuss? Answer: history of sexually transmitted infections, STIs. Rationale: STIs like chlamydia and gonorrhea can cause scarring of reproductive organs, leading to infertility. 20. A nurse is assessing a client receiving magnesium sulfate for severe preeclampsia. What finding indicates magnesium toxicity? Answer: decreased deep tendon reflexes and respiratory depression. Rationale: magnesium sulfate toxicity causes neuromuscular and respiratory depression, requiring immediate intervention such as stopping the infusion and administering calcium gluconate. 21. A nurse is assessing a client who is 10 hours postpartum. The fundus is firm, midline, and at the level of the umbilicus, but the client is passing large clots. What is the nurse's priority action? Answer: assess the client's perineum for excessive bleeding and retained placental fragments. Rationale: even with a firm fundus, large clots and excessive bleeding may indicate retained placental tissue, which increases the risk of hemorrhage. Further assessment is necessary. 22. A nurse is providing discharge teaching to a client who had a cesarean birth. What instruction should the nurse prioritize? Answer: avoid lifting heavy objects and monitor for signs of infection. Rationale: heavy lifting increases the risk of dehiscence, and monitoring for fever, redness, or drainage helps detect early signs of infection. 23. A client at 30 weeks gestation is diagnosed with gestational diabetes. What fetal complication should the nurse monitor for? Answer: macrosomia, large for gestational age. Rationale: uncontrolled maternal glucose levels lead to excessive fetal growth, increasing the risk of birth trauma and complications during delivery. 24. A nurse is caring for a newborn with an APGAR score of 4 at 1 minute. What is the priority nursing intervention? Answer: provide positive pressure ventilation and reassess. Rationale: a low APGAR score indicates respiratory distress. Positive pressure ventilation supports oxygenation and improves the newborn's condition. 25. A pregnant client presents with right lower quadrant pain, rebound tenderness, and nausea. What should the nurse suspect? Answer: appendicitis. Rationale: appendicitis can occur during pregnancy and may be mistaken for normal pregnancy discomfort. Immediate evaluation is necessary to prevent rupture. 26. A nurse is providing education to a client who is breastfeeding. Which dietary instruction should the nurse include? Answer: increase caloric intake by approximately 500 calories per day. Rationale: lactating mothers require additional calories to support milk production and provide adequate nutrition to the newborn. 27. A nurse is caring for a client who is 38 weeks pregnant and experiencing severe itching without a rash. What should the nurse suspect? Answer: intrahepatic cholestasis of pregnancy. Rationale: cholestasis causes bile acid accumulation, leading to itching and an increased risk of fetal complications. Prompt medical evaluation is needed. 28. A laboring client suddenly complains of severe chest pain, dyspnea, and cyanosis. What is the nurse's priority action? Answer: administer high-flow oxygen and notify the provider immediately. Rationale: these symptoms suggest an amniotic fluid embolism, a life-threatening condition that requires immediate intervention to support oxygenation and circulation. 29. A postpartum client with a history of major depression reports difficulty bonding with her baby. What is the nurse's best response? Answer: assess for postpartum depression and offer emotional support. Rationale: postpartum depression can interfere with bonding and maternal health. Early assessment and intervention improve outcomes for both mother and baby. 30. A nurse is educating a client about the purpose of a non-stress test, NST, at 32 weeks gestation. What statement indicates understanding? Answer: the test monitors my baby's heart rate in response to movement. Rationale: an NST assesses fetal well-being by evaluating heart rate accelerations in response to fetal movement, indicating adequate oxygenation. 31. A nurse is assessing a newborn whose mother had untreated syphilis during pregnancy. What findings should the nurse anticipate? Answer: a maculopapular rash on the palms and soles. Rationale: congenital syphilis presents with characteristic skin rashes, hepatosplenomegaly, and potential neurological complications. Early identification is crucial for treatment. 32. A client at 41 weeks gestation is scheduled for labor induction. What assessment must the nurse perform before administering oxytocin? Answer: assess cervical readiness using the Bishop score. Rationale: the Bishop score evaluates cervical dilation, effacement, consistency, and position, helping determine the likelihood of a successful induction. 33. A nurse is caring for a client who had a spontaneous rupture of membranes, SROM, 2 hours ago. What is the priority nursing action? Answer: assess fetal heart rate for any abnormalities. Rationale: after SROM, there is a risk of umbilical cord prolapse, which can lead to fetal distress. Fetal heart rate monitoring ensures early detection of complications. 34. A pregnant client asks why her provider recommended folic acid supplementation. What is the nurse's best response? Answer: folic acid helps prevent neural tube defects in your baby. Rationale: folic acid is essential for fetal neural tube development, reducing the risk of conditions like spina bifida. 35. A client at 16 weeks gestation reports sudden sharp pain in her lower abdomen when changing positions. What is the likely cause? Answer: round ligament pain. Rationale: round ligament pain is a common pregnancy discomfort due to stretching of the ligaments that support the uterus. It is harmless but can cause sharp pain. 36. A nurse is providing postpartum discharge instructions to a client who had a third-degree perineal tear. What should the nurse include? Answer: use a stool softener and increase fluid intake. Rationale: stool softeners and hydration prevent constipation and reduce strain on the healing perineal tear, promoting comfort and recovery. 37. A nurse is preparing a client for a hysterosalpingogram. What pre-procedure teaching should the nurse provide? Answer: you may feel some cramping and mild spotting is normal after the procedure. Rationale: a hysterosalpingogram evaluates fallopian tube patency using contrast dye. Clients may experience mild cramping and spotting, which is expected. 38. A nurse is caring for a client who had a molar pregnancy, hydatidiform mole. What complications should the nurse monitor for? Answer: choriocarcinoma. Rationale: a molar pregnancy increases the risk of gestational trophoblastic disease, including choriocarcinoma, a malignant tumor requiring monitoring of HCG levels. 39. A client in labor suddenly experiences a firm, board-like abdomen and intense uterine pain. What is the nurse's priority action? Answer: Notify the provider immediately and prepare for emergency delivery. Rationale: a firm, painful uterus suggests placental abruption, which can compromise fetal oxygenation and lead to hemorrhage. Immediate intervention is necessary. 40. A nurse is caring for a client receiving a blood transfusion for postpartum hemorrhage. The client develops chills, fever, and back pain. What is the nurse's priority action? Answer: stop the transfusion immediately and notify the provider. Rationale: these symptoms indicate a transfusion reaction, which can be life-threatening. Stopping the transfusion prevents further complications.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!